let's talk about a moment no one wants to imagine, but one that every senior and their loved ones should be prepared for. It's a moment that strikes with sudden, terrifying speed, when the world seems to shrink down to a single pounding question: what do I do right now? We're talking about the frightening possibility of a stroke. In such a critical moment, fear can be paralyzing, and confusion can cloud our judgment. It is precisely in these heart-pounding minutes, the precious window of time between realizing something is terribly wrong and the arrival of professional medical help, that your actions become the most powerful tool you have. In this video, we will walk through a specific set of actions, a kind of 5-minute strategy designed to be implemented quickly and effectively. These are not actions that require great physical strength or medical training. They are actions of presence, awareness, and simple, purposeful steps that can dramatically influence the outcome for someone you care about, or even for yourself. Before we continue, we're building an amazing community here, and I'd love to know who's watching. Drop a comment below and tell me where you're from, along with one interesting fact about your city. We read and reply to every single comment, so don't be shy. Share yours below. This video is for informational purposes only and should not be considered medical advice. Always consult a qualified healthcare professional or registered dietitian for personalized guidance. Now, without further delay, let's dive deeper into the video. The first action you must take is to get professional medical help on the way without a moment of hesitation. This step, make the emergency call yourself, may seem obvious, but in the panic and confusion of a medical emergency, people often fall into dangerous traps of indecision or delegation. The impulse might be to call a son or daughter, to run to a neighbor for help, or to spend precious minutes discussing what to do while the person's condition potentially worsens. It is absolutely critical that you, as the person on the scene, take direct and immediate responsibility for contacting the emergency services. This is not a task to hand off to someone else who might not understand the urgency or the specifics of the situation. By taking control of the call, you become the vital link between the person in crisis and the advanced medical care that they so desperately need, ensuring that the message is delivered accurately and that the response is triggered with the speed that a stroke demands. When you dial the emergency number, you will be connected to a trained dispatcher whose job is to gather information quickly and dispatch the appropriate help. Your role in this conversation is to be a calm, clear, and authoritative source of information. The first words out of your mouth should be a clear declaration of the emergency. Instead of saying, "Someone is sick," or "My friend doesn't look right," you must use the specific term. "I need help. I believe someone is having a stroke." Using the word stroke is like flipping a switch for the dispatcher. It immediately elevates the priority of the call and triggers a specific protocol for responding to a potential stroke patient. The dispatcher is now primed to ask you the right questions and will relay this critical information to the paramedics who are already on their way, allowing them to begin their preparations while in transit. This simple act of naming the emergency correctly can shave valuable minutes off the response time and ensure the right resources are sent. After stating the nature of the emergency, the dispatcher will need to know your location. This seems fundamental, but in a state of panic, people can sometimes become disoriented or provide unclear addresses. If you are at home, state your full address clearly, including any apartment number. If you are in a public place like a shopping mall, a park, or a library, try to give the most specific location possible. We are near the main entrance of the community center, or we are on a bench on the south side of the park. The goal is to make it as easy as possible for the paramedics to find you without having to search. The dispatcher will also likely ask for your phone number, so they can call you back if you are disconnected. It is crucial that you do not hang up the phone until the dispatcher explicitly tells you to do so. They are trained to keep you on the line to gather more information, provide you with potentially life-saving instructions, and monitor the situation until help arrives at your doorstep. In the whirlwind of activity that follows recognizing a stroke, there is one simple, quiet action that holds immense power for the medical team who will soon take over. Noting the exact time the symptoms first began. This may appear to be a small, almost trivial detail amidst the urgency of calling for help and tending to the person, but in the context of a stroke, the clock is the single most important piece of diagnostic and treatment information available. Doctors often refer to the time of symptom onset as the cornerstone of stroke care because the most effective clot-busting medications can only be administered within a strict and limited time window, often within just a few hours of the first sign of trouble. Knowing this precise time allows emergency physicians to rapidly and confidently determine whether a patient is eligible for these treatments, which can stop a stroke in its tracks and dramatically reduce long-term disability. The challenge, of course, is that in the moment your mind is racing and noting the time may be the last thing you think of. The instant you see a drooped face, a drifting arm, or hear slurred speech, your eyes should immediately go to a clock, a watch, or the time display on your phone. Do not make a rough guess. Do not say, "It was about 10 minutes ago." Be exact. If the clock says 10:22 a.m., then 10:22 a.m. is the time you must remember and communicate. This precision is not pedantic. It is medically critical. A treatment that can be safely given at 3 hours and 15 minutes may be too risky to administer at 3 hours and 45 minutes, as the potential for serious complications, like bleeding in the brain, increases as time passes. Your accurate timestamp is the key that can unlock access to life-saving treatment. To ensure this vital piece of information is not forgotten or lost in the chaos, take proactive steps to secure it. The simplest method is to grab a pen and paper and write it down in large, clear numbers. If you don't have writing materials, use your phone. Type it into a notes app or even text it to yourself. Another highly effective approach is to verbalize the time to another person. If someone else is with you, look at them and say, "It is 2:15 p.m. right now, and that is when the symptoms started." By sharing this information aloud, you create a shared memory and a backup witness. You can also tell the person experiencing the stroke if they are alert. It's okay. Help is coming. It started at 2:15, and they will know what to do. This not only helps reinforce the time in your own mind, but also provides a small measure of reassurance for them. When paramedics arrive, immediately and clearly provide them with this information. As they assess the patient, step forward and say, "I believe he is having a stroke." The symptoms started at exactly 10:22 a.m. This single sentence gives the emergency team a powerful head start. They will relay this information to the hospital, and the stroke team will be ready to spring into action the moment the patient arrives. Your simple act of noting the time transforms you from a bystander into an essential member of the healthcare team. You are providing a crucial detail that no brain scan can replicate, and that the patient, especially if their memory or speech is affected, may not be able to provide. Once you have called for help and noted the time, your immediate focus must shift to the physical safety and comfort of the person having the stroke. This step, "Help them rest safely," is all about creating a secure environment to prevent additional injury while you wait for the paramedics to arrive. A person experiencing a stroke is often dizzy, disoriented, and has compromised balance and muscle control, which makes them a very high risk for a fall. A fall on top of a stroke could lead to a head injury or broken bones, complicating their medical situation tremendously. Therefore, your goal is to gently and carefully guide them from a standing or sitting position to a much safer one on the ground or on a stable supportive surface, minimizing any movement that could cause them to lose their balance and tumble down. The ideal position is to have the person lie down on their side, specifically on the side that is not affected by the stroke, if you can determine it. This is often called the recovery position in first aid, and it serves a crucial purpose. During a stroke, the person may experience nausea or even vomit due to the pressure and distress in the brain. If they are lying flat on their back, vomit can easily be inhaled into the lungs, leading to a dangerous condition called aspiration pneumonia, which is a serious and potentially life-threatening complication. By rolling them onto their side, you are using gravity to help keep their airway clear, allowing any fluids to drain out of the mouth instead of down into the windpipe. If you are unsure which side is weaker, simply choose one side. The key is to get them off their back. Bend the knee of the top leg to stabilize their body and gently tilt their head back slightly to keep the airway open. If moving the person to the floor seems too difficult or they are resisting, the next best option is to help them sit down securely in a sturdy chair with arms or on a couch. The important thing is to get them into a position where they are fully supported and cannot tip over. Once they are seated or lying down, you can make them more comfortable by providing some soft support for their head. A pillow from a couch, a cushion, or even a rolled-up jacket or sweater placed under their head can make a significant difference in their comfort level. It is a small gesture of care that can be incredibly soothing in a moment of terror and confusion. If they are outside, use whatever you have available. A purse, a folded coat, anything that can provide a buffer between their head and the hard ground. Throughout this entire process, it is vital that you move the person slowly and explain what you are doing in a calm, reassuring voice. Say things like, "I'm just going to help you sit down here so you don't fall," or "I'm going to make you more comfortable on your side until the ambulance gets here." Your voice can be an anchor in their storm of confusion. Do not offer them a pillow or blanket that might obstruct their breathing, and certainly do not give them anything to eat or drink. Your role here is purely one of support and safety. In the midst of a major health crisis like a stroke, an action as simple as loosening a collar or unbuttoning a shirt cuff might seem almost too minor to matter. However, this step, loosen tight clothing, is a small but profoundly important intervention that addresses two critical needs: promoting better blood circulation and making it easier for the person to breathe. When the body is under the immense stress of a stroke, the circulatory system is already compromised in the brain. You do not want to add any further restrictions to blood flow in the rest of the body. Furthermore, the anxiety and physical trauma of the event can make a person feel as if they are suffocating, and any constriction around the neck or chest can intensify this terrifying sensation. By carefully removing these physical barriers, you are taking a proactive step to support the body's basic functions during a time of extreme duress. Start by focusing on the areas of the body where clothing is most likely to be restrictive. The neck is the absolute priority. Gently loosen or remove a tight necktie, unbutton the top button of a dress shirt, or loosen the zipper on a jacket that is fastened all the way up. A tight collar can put pressure on the carotid arteries in the neck, which are the main highways for delivering oxygen-rich blood to the brain. While loosening a collar won't reverse the stroke, it can help ensure that what blood flow is still possible is not being unnecessarily hindered by something as easily removable as clothing. It also immediately relieves the feeling of being choked or constrained, which can have a noticeable calming effect on a person who is likely feeling panicked and trapped inside a failing body. Next, turn your attention to the waist. A tight belt or the waistband of constrictive trousers can impede circulation and make deep, relaxing breaths difficult. If it is possible, gently loosen the belt buckle or unbutton the top button of the pants. The goal is to create a sense of physical ease and expansion around the torso, allowing the diaphragm to move more freely with each breath. Finally, check the wrists. Cufflinks on a formal shirt or a tightly buttoned shirt cuff can act like a tourniquet, especially if there is swelling. Simply undoing the cuff and rolling the sleeve up slightly can help ensure healthy blood flow to the hands. If the person is wearing a watch with a tight band, consider sliding it up their arm or carefully removing it altogether. In a moment of crisis, our most human instinct is to offer comfort, and often that comfort takes the form of a sip of water, a reassuring pat, or the offer of a familiar pill. When faced with a senior who is having a stroke, it is absolutely critical that you override this instinct. This step, do not give food, drink, or medicine, is a directive of restraint, and it is one of the most important rules to follow. While it may feel like you are not doing enough to help by withholding these things, in reality, you are actively preventing a series of potential complications that could severely worsen the person's condition and jeopardize their recovery. The simple, unwavering rule is this: nothing should pass the lips of a person who is having, or is suspected of having, a stroke until they have been fully assessed by a medical professional in a hospital setting. The primary reason for this is the high risk of choking and aspiration. A stroke often affects the delicate muscles in the throat and the complex nerves that control the swallowing reflex. What seems like a simple automatic action, swallowing a sip of water, can become impossible. The liquid, instead of going down the esophagus and into the stomach, can easily be misdirected into the trachea and wind up in the lungs. This is called aspiration, and it can cause a serious and damaging lung infection known as aspiration pneumonia. Fighting off a severe pneumonia is a massive challenge for anyone, but for a senior whose body is already reeling from the assault of a stroke, it can be a devastating secondary blow that prolongs hospitalization, complicates recovery, and can even be life-threatening. The same danger applies to food or even a small piece of candy meant to boost blood sugar. It can become a choking hazard. Furthermore, you must never, under any circumstances, give the person any medication, especially aspirin. It is a common misconception that aspirin is a universal treatment for stroke symptoms. This is dangerously incorrect. There are two main types of stroke: an ischemic stroke, which is caused by a clot blocking a blood vessel in the brain, and a hemorrhagic stroke, which is caused by a burst blood vessel bleeding into the brain. Aspirin is a blood thinner that can be beneficial for an ischemic stroke because it helps prevent further clotting. However, if the stroke is a hemorrhagic stroke, giving aspirin would be catastrophic, as it would thin the blood even more and could dramatically increase the bleeding in the brain, causing far more extensive damage. Without a CT scan at a hospital, it is impossible for you to know which type of stroke is occurring. Therefore, the only safe course of action is to give nothing at all and let the doctors make that determination with the proper diagnostic tools. A stroke is a sudden and frightening event, but as we have detailed through these 8 steps, it is not an event where you are powerless. This knowledge is not meant to burden you with fear, but to empower you with purpose. You now hold a simple step-by-step blueprint for action that bypasses panic and replaces it with purposeful, compassionate, and effective care. Remember these steps, discuss them with your senior friends and family members, and share this knowledge freely within your community. In doing so, you are not just learning first aid, you are becoming a guardian of independence and a beacon of hope